So, speaking of all these restrictions and all, with regard to COVID-19, we do have Dr. Wheeler on the line, who is the WHO and PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands. Good morning, Dr. Wheeler.
Good morning, Carrie. Long time no see.
Yeah, it really has been. It's really great to be chatting with you, and on a lighter note this time, because we've seen some of the restrictions removed. So, first off, when it comes to these removal of restrictions, what do you think are some of the key things that, well, not only the powers that be, but that the public should be paying attention to?
Okay, thanks, Carrie. Good question. I want to say that not because restrictions are being relaxed that we should be complacent. Throughout this whole process, we've been talking about public health measures, and I think by now, most of all of the population must have heard the advice by PAHO and WHO about the public health measures, which means that we still have to continue to observe physical distancing because the virus has not changed in the way that it is transmitted from one person to another in terms of its proximity. Right. We know now certainly what we didn't know at the beginning, which we weren't sure of, but we know now there are asymptomatic people who can spread the virus, meaning without any symptoms. So the physical distancing is important. We know more now about the type of cloth mask that we should be using. WHO has recommended cloth masks with at least 3 layers for those who are making their cloth masks. And there are different types now that are available that are safer than in the beginning. So we need to make sure we keep our masks on. Please don't wear fancy masks that are knitted.
Right.
And we know now that certainly for outdoor exercise, for example, we can wear face shields, but we still have to keep our physical distance, even though we wear face shields, because you can't comfortably or easily wear a face mask because you can have microorganisms in the mask if you're doing heavy breathing and sweating.
Right.
So essentially, and of course, washing our hands and cough etiquette, we have not changed the public health measures. They do not change. Most of them were in place in 1918 during the Spanish flu pandemic. So relaxation of the measures means that we have to continue to be vigilant because remember, we still do not have a vaccine. Remdesivir has been approved in the US as a therapeutic, but it has not yet been approved globally by WHO. So we still must be responsible. We must take an all of society approach to this pandemic. And I know it's difficult and it could be stressful, but we still need to do that. We still don't need to gather in large groups and all that sort of thing, because that is inviting the virus back in to our space. So the watchword still is to be responsible.
Yeah, to be responsible really is the watchword. So now that we've seen the release of measures, as we've seen in the past, the ease up of restrictive measures, as we've seen in the past, the measures are released and then the cases went up. And in other countries, as we've seen as well, a similar situation where measures are released, cases go up, then they put measures back in, cases go down again, in a kind of seesaw effect. Is that what we can expect to happen for the continued future, that they're going to release measures and we're going to see this kind of seesaw happening?
Yeah, well, unfortunately, because of the nature of the virus, it congregates where people congregate. So where I think with the measures with opening up, remember for churches, it's still 50% with social distancing. So it's not a case of we're going back to normal, everybody's going to church, nobody's wearing a mask, everybody's sitting next to each other in a pew. But I think your question about whether we will see the seesaw, the answer is yes. The reason why, it's because whenever we relax measures and people congregate, it's not only just the relaxation of measures, it's the fact that if people don't continue to do what they should do, the virus, is sparked again, because it is the case where if you're in close quarters, for example, indoors, where it's crowded and there is poor ventilation, the virus can be transmitted more easily. That's why the face masks important, and that's why the physical distancing continues to be important. But yes, everywhere in the world, you will see the opening up and then the closing down, because we must have economies that are functioning to some degree. Otherwise, that balance between life and livelihoods is lost. So we can't permanently shut up everything and keep everybody in place all of the time. I mean, WHO and PAHO has never said that.
Right.
But you have to look at the context. And we are still in community spread. We have not gone back to clusters yet. So we will have that situation where sometimes measures can be restricted. And if the numbers go up again, as they did before, there would have to be restrictions again on movement. But now we know it is mostly the big gatherings and the indoor groups of people without masks that cause transmission.
And speaking of that specific point, quickly, we have about 1 minute. How do individuals stay safe in public places like the beach and stuff that has just opened up again?
Well, certainly for beaches, even though it's outdoors, now being outdoors is better than being indoors. So when we are outdoors at the beach, we still need to observe physical distances, especially between non-family member groups. You go with your family, you're together, but for people who are not part of your family, you still have to observe the physical distancing. So not because you're on the beach means that you have to be clustered together and having parties and that sort of thing. No, where that has happened in Europe and other places, there have been spikes again. So please, we should not be doing that.
Right. And with that, I want to thank you so much, Dr. Wheeler, for joining us this morning and, continuing to keep us informed as it comes to COVID-19, safety measures, and so much more. So I want to thank you and have a great morning, Dr. Wheeler.
Thank you. You too, Carrie. Bye for now.
All right. That was Dr. Erica Wheeler, who is the WHO and PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands.